Hello everyone, welcome back to Jacob's Academy of Nursing. I'm really glad you are here today in this session, and we will be learning an important foundation topic for all nursing and healthcare students. The topic is tissues, and we'll see the structure, types, and nursing importance. And this topic will strengthen your basic and important in both theory and clinical practice. So stay with me till the end of the video to make sure you don't miss any point, like important points. Before we begin, let me quick walk you through the contents of today's session. First, we'll see the introduction, type of tissues, classification of tissues, functions of tissues, classification of epithelial tissue, tissue level changes, examples in nursing practice, nurse must know about tissue, and we'll see the summary. So, we are starting with one of the most fundamental concepts in human anatomy and physiology, tissues. So, we'll see the introduction of tissue, okay? A tissue is a group of cells that are similar in structure and work together to perform a specific function. So, in the human body, cells do not work alone. These organize themselves into tissues, and tissues build organs, and organs form complete body system. So when we understand tissues, we are actually learning the foundation of how the entire body is built and how it functions. So in this topic, especially important for nursing students because many clinical conditions begin at like tissue level, such as inflammation, ulcers, cancers, degenerative changes, pressure injuries, muscle weakness, and nerve damage. By understanding tissues, we can better understand disease process, perform assessments more accurately, and provide safer, more effective patient care. So in today's session, we will explore the structure of tissues and the different types of tissues in the body and their nursing importance, which will help you build a strong theoretical and clinical base. So here is an introduction. Tissues are groups of similar cells that work together to perform a specific function in the body. They form the basic building blocks of the organs, and understanding them is important because many diseases and healing process begin at the tissue level. Now let's move into the most important part of today's session. The four main types of tissues in the human body. Each tissue type has a unique structure and function, and together they form all the organs and systems of the body. So in that, first we will see epithelial tissue. So what is epithelial tissue? This tissue covers the body surfaces and lines internal organs and form glands. So it will work like a protective barrier, preventing injury, infection, and fluid loss. Depending on its location, it also performs absorption, secretion, filtration, and excretion. So the examples are the skin and the respiratory tract. Means it's a lining of the respiratory tract. And the other one is lining of the digestive system and the glands in our body. Because these cells are tightly packed and they offer excellent protection. So next we have connective tissue, the most abundant and widely distributed tissue in the body. Its role is to support, protect, and bind other tissues. Connective tissue includes bone, cartilage, tendons and ligaments, blood, and adipose, means fat tissue. It contains cells that are spread apart within a matrix, which may be fluid, semi-solid, or solid. And this structure allows connective tissues to transport nutrients, store energy, fight infections, and provide physical support. That is connective tissue. So here one image is there for epithelium and connective tissues and the layers. Third type is muscle tissue, and it's responsible for producing all type of movement in the body. There are three types: skeletal muscle, cardiac muscle, smooth muscle. So coming to skeletal muscle, it means attached to bones and helps in voluntary movements such as walking, lifting and speaking. So coming to cardiac muscles, it's found only in the heart. It contracts continuously and rhythmically to pump blood throughout the body. And the third one is smooth muscles. So it found in the organ like a stomach, intestine, bladder and blood vessels. So these muscles work involuntarily and helps with functions such as digestion and blood flow. Next one we'll see nervous tissue. So the final type is nervous tissue, and which control and coordinates all body activities. It made up of neurons, neurological cells. So we'll see here neurons. It means the cell that transmit electrical impulses, and neurological cells means the supporting cells that protect and nourish neurons. And the nervous tissue forms the brain, spinal cord and peripheral nerves, allowing communication between different parts of the body. And these tissues help us think, feel, respond to stimuli and maintain homeostasis. Here's the image for muscle tissue and nervous tissue. Now, let's look at the classification of epithelial tissue, which is based on two main features. First one is the number of cell layers and the other one is the shape of the cell. So, understanding this classification is important because each type has a specific structure and function in the body. So, based on the cell layer, first one is simple epithelium. So, this type has a single layer of cells. It is thin and ideal for processes such as absorption, diffusion, filtration and secretion. And examples are lining of the alveoli, blood vessels and intestine. So coming to stratified epithelium, this has multiple layers of cells. And the main function is protection because the outer layers can handle wear and tear. And examples: skin, lining of the mouth and esophagus. And the last one is pseudo-stratified epithelium, which means these tissues appear to have multiple layers. But in reality, all cells are attached to the basement membrane. So it is actually a single layer commonly found in the respiratory tract, where it helps trap and move particles using cilia. And coming to based on cell shape, first one is squamous epithelium, which means the cells are flat and thin like tiles, ideal for diffusion and filtration. For example, alveoli of the lung. Second one is cuboidal epithelium, which means the cells are cube shaped. These cells help in secretion and absorption. For example, kidney tubules. And the last one is transitional epithelium. It is unique because it is specially designed to stretch and expand. Unlike other epithelial types, the cells of transitional epithelium can change their shape depending on how much the organ is filled. For example, we can tell when the organ is empty, the cells are rounded or dome shaped. And the other one is when the organ is full or stretched, the cell become flat. This ability to change the shape is what gives it the name transitional. And the transitional epithelium is found only in the urinary system where expansion is required. Major locations are urinary bladder, uterus, part of urethra, renal pelvis. And these organs constantly change their volume depending on urine flow, and transitional epithelium allows them to do this without tearing. So that means transitional epithelium. Next we can see special types. That one, glandular epithelium. So the glandular epithelium is the tissue that forms the glands of our body, and its primary role is secretion, which means the produce and release substance that the body needs for normal functioning. These secretions are include enzymes, hormones, sweat, mucus, saliva, milk. Exocrine glands. These glands release their secretion onto body surfaces or into body cavities through duct. For example, sweat glands, salivary glands, mucus glands, mammary glands. And their main function are lubrication, protection, temperature regulation, and digestion. And coming to endocrine glands, these glands do not have ducts. Instead, they release their secretions, mainly hormones, directly into the bloodstream. For example, pituitary gland, thyroid gland, adrenal gland, pancreas. So these hormones help regulate growth, metabolism, stress response, reproduction, and many body processes. Next, we can see tissue level changes, clinical relevance. This one is inflammation, fibrosis means scarring, degeneration, example, muscular dystrophy. Last one is cancerous changes. Coming to the examples in nursing practice, first one is dermatitis means epithelial inflammation, edema, fluid in connective tissue, gastroparesis, smooth muscle dysfunction, neuropathy means nerve damage. Next, we can see nurses must know about tissues. Nurses must understand tissues because all organs and disease begin at the tissue level. When tissues change through inflammation or infection, injury or degeneration, and the patients develop symptoms that we assess every day. So the knowledge of tissues which help nurses recognize early signs of problems and understanding wound healing, interrupt clinical changes, and provide safe, effective care. In simple terms, good nursing assessments start with understanding how tissues work and how they get damaged. So here we can see some points which will help identify disease change, essential for wound assessment, understand biopsy reports, explains symptoms and patient conditions. So we can summarize the topic here. Tissues are groups of similar cells that work together to perform essential functions in the body. The four main tissue types, epithelial, connective, muscles and nervous, forms the foundation of all organs. Each type has a unique structure and role, and most disease and healing process start with changes at the tissue level. Understanding tissue levels, which helps the nurses to recognize the clinical symptoms, assess wounds, identify early signs of diseases, and deliver effective patient care. Thank you all for staying with me throughout this session. I truly appreciate your time and interest in learning about the topic tissues. And I hope this class has helped you understand the topic more clearly, and I will support you in your studies, yeah, and clinical practice. So keep learning, keep growing, and I will see you in the next class. So take care, bye, and support the channel, Jacob's Academy.